Hello, we're going to talk about health disparities in children with intellectual disabilities and minority and racial ethnic groups. Sorry if it appears I'm reading off a screen. I wrote down a script. So health disparities are preventable differences in health outcomes that affect certain groups more than other groups, particularly the marginalized groups, including those with intellectual disabilities. People with intellectual disabilities often face health challenges, but when that's combined with racial and ethnic minority status, in addition to having intellectual disability, that gap increases for healthcare and different things as such. So studies show that people with intellectual disabilities can have shorter life expectancies and higher rates of mental and physical health conditions, and that they're more likely to get preventative care and still have unmet health needs. And this is because they're typically just not understood, honestly. The main reasons for these disparities include limited access to healthcare. So a lot of healthcare providers are not trained to support people with intellectual disabilities. There's stigma and discrimination still associated around intellectual disabilities, although there has been an increase in the awareness and the amount of education that's being put out. There's still stigma and disparities that exist. And then social factors such as income, education, environment, which all can make it harder to stay healthier, especially with those with intellectual disabilities. So to reduce these disparities, we can improve access to healthcare. We can provide better training for healthcare providers, especially throughout the schooling process. And then we need to increase community support for minority groups with intellectual disabilities. And then we need policies that promote health equity. I feel like those could make a really big difference in the overall outcomes. But the main thing will be having cultural competence. And that doesn't just go for if someone's a different nationality, but intellectual disability should also be included in those groups. And I know this video is really short, but in order to improve the healthcare challenges that people with intellectual disabilities face, we need to, one, prevent this from happening. Like, it's completely preventable. We just need education in the system, and we need to really take into account the full person and view people as people. Although there isn't a specific number of how many people with intellectual disabilities actually face healthcare challenges, studies have shown that increasingly over time, those with intellectual disabilities face more healthcare challenges than those without intellectual disabilities. So it's a really big thing, and it's one of the things that SoMeFit is kind of striving to also prevent and be a part of the change, which I genuinely appreciate, and thank you so much for watching my video.